Hello everybody, this is Uttara from first MSc Biotech, VIT Vellore. Today I am going to talk about Echinococcus granulosus. Echinococcus granulosus is nothing but a common parasite that lives on the dogs. It is mostly spread via dogs. Echinococcus granulosus is also called as a hydatid worm or a dog tapeworm. As I already said, it is a common parasite that lives on the dog, which belongs to a cestode family. So it lives in the intestinal walls of the dogs. The larval stage is also called as the hydatids. So it requires two host types. One is definitive host and then intermediate host. Definitive host is the host from which the parasites are passed on, that is the dogs. Whereas the intermediate host are us, like human beings, sheep, cattle, etc., through which it spreads. So mainly the intermediate host is human beings, especially the children. On to the taxonomy, domain Eukaryota, king Animalia, class Cestoda, order, family, genus and species, where genus is the Echinococcus and species is the Echinococcus granulosus is the species. Epidemiology. Echinococcus granulosus was first documented in Alaska, and it is also most prevalent in the places like North and East Africa, Australia, South America, etc., wherever they practice sheep gazing. That is, it is passed from the sheep and then it is taken up by the dogs and then passed to the human beings. Morphology. The adult worm is 3 to 6 mm in length. It has 3 scolex, which is nothing but the head, neck and then body. Body is also called as strobili. It is also has an egg, which is the infective stage. That is, the larval stage is the infective stage. Scolex. It is pyriform, 300 mm in diameter. It has 4 suckers in it. Neck. It is short and thick. Strobili, as I said, it is also known as the body. So it consists of 3 segments, where the last segment is the biggest. It measures 2 to 3 mm in length and 0.6 mm in breadth. Larva is also called as the hydatid cyst. As I said, it is the infective stage of the parasite. So hydatid fluid. The inside of the cyst, this cyst is filled with a clear colorless fluid, and it may be pale yellow sometimes, and that is known as hydatid fluid. Transmission. Echinococcus granulosus is a zoonotic disease. That is, the disease is passed from the animals. So it can be by two ways, either direct contact from the infected dogs or indirectly through water, food or other materials that are contaminated with the eggs of this parasite. Incubation period, it may extend from months to years. It is asymptomatic, that is, it doesn't show any symptoms at all. And in some patients, the cyst may persist for some years also, which can also be lethal to the human beings. As I said, definitive host and intermediate host. This parasite has two hosts. So in this picture you can see definitive host is dogs and canines, whereas the intermediate host can be sheep, cattle, herbivores, human beings. Especially this is passed to the children from the dogs, especially because they are used to playing with the animals, right? So Genesis. The eggs are discharged in the feces of the dogs and then they are swallowed up by the sheep while gazing in the field, and the children, due to touching of the infected dogs, they just take it up. In the duodenum of the sheep, the embryo are hatched out. As you can see in this diagram, then after hatching out, it passes through the intestinal wall and are carried out by the blood to various organs like lungs, liver, especially the lungs and livers are affected. Then it increases in the size in lungs and livers and then transforms into an hydatid cyst. As the cyst grows older in the lungs and livers, free prostocolicus float freely inside the hydatid cyst. Now the dogs gain infection by the ingestion of these hydatid cysts containing these prostocolicus and brood capsules. Now these prostocolicus, what it does, it goes and attaches with the intestine of the dog, and then it develops into mature adult worms and then produces infective eggs. These infective eggs are infective to the man. You can see the upcoming picture also to understand it in a clearer way. What is protocolicus and all, and where does it infect, how it infects the lungs and livers, how it is ingested, everything. Told you the prostoscolitis attaches to the intestinal walls of the dogs and forms into a mature adult worm, and then it produces eggs. These eggs are the infective stage, that is the larval stage, which is responsible for the causage of the infection, and they are infective to man. It mainly causes the mechanical damage. Benign cyst may be asymptomatic and produces physical burden to the patient. Then imagine how long it will persist in the human being. As I told you, this is asymptomatic and can live for even years inside the human body. Clinical manifestation, it causes cystic echinococcus. Hydatid cyst is responsible for the pathogenesis of the disease. So conditions persist as asymptomatic, as I told you before, and it stays for a longer period of time. The clinical symptoms depends upon the organ that is involved, especially the lung and the liver, and the complication occur due to the rupturing of the cyst. Four major clinical manifestation. The first one is the hepatic hydatid. It is seen in 66% of the cases, causes pain, nausea, vomiting, hypertension. The cyst may rupture into bile duct leading to jaundice, fever, eosinophilia, etc. Second one is the pulmonary hydatid. It is seen in 22% of the cases. The cyst occurs, written lung causes, hemoptysis, transient thoracic pain. It causes shortness of breath, so it causes difficulty in bleeding. If the rupture is incomplete, the cyst may transform into chronic pulmonary abscess. Especially the patient has cough with sputum that contains blood. One is the brain cyst. It is seen in 1% of cases. A large cyst may lead to increased intracranial tension, that is headache, vomiting, poor vision, etc. Last one is the renal cyst. It is seen in 3% of the cases. It causes intermittent pain, that is a gap, and the pain will start coming. Then hydatid sand may be present in the urine. Hydatid cyst of spleen, heart may be present like a tumor or an abscess. Diagnosis. First thing is the imaging, that is by using CT, USG and X-ray. CT detects 90 to 100% of the cases. It detects more accurately. USG detects both single and multiple cystic lesions. X-ray, it detects the hepatomegaly and calcified cysts and the cysts that are even present in the lungs. Examination of the cyst fluid, it reveals the scoliosis and brood capsules. Then the serodiagnosis, antigen and antibody detection. Antibodies detection is done by IHA and ELISA, enzyme linked immunosorbent assay. Antigen by double diffusion and CIED method. Test is done where immediate hypersensitivity reaction occurs to the antigen, where the antigen is the hydatid fluid that is taken from the men or dog. Interpretation is nothing but the sensitive patients, they develop Raj wheel measuring 5 centimeter. Then the treatment is done by mebendazole, albendazole and praziquantel. Praziquantel is mainly used as a drug of choice for prostoscolicis, for inhibiting the prostoscolicis from forming. So that's it. We have come to an end. So thank you guys. I hope you guys would have understood about the parasite clearly. Thank you so much.